No, no, no. That will be separate. That will be clinical classes. That will be from second year onwards. So early clinical exposure is to give you certain orientation to clinical field, because in first year in anatomy, biochemistry and physiology, most of the things you will see that in earlier periods we used to not mention the applied part or the clinical part in our first year classes, but from the recent CBME guidelines we are incorporating the clinical scenarios in from first year onwards to give an exposure to you regarding the clinical field, because that is what you are going to see during your practice time. So today we will be discussing about fracture of long bones. So first of all, tell me uh, what is the specialist called who generally operates with these bones and these fractures? Orthopedician. So this comes from ortho. Ortho means bones. So basically, before that, as I have already told you that anatomy will keep on haunting you. So in orthopedics, most of it will be only anatomy only. So in orthopedics, almost 80 to 90% thing will be only anatomy. 10% will be coming to the treatment part. I mean, obviously treatment will come after the after knowing the anatomy, but anatomy will be preceding the treatment part. So first of all, let us have certain basic revision about what is long bone. So how many parts of long bones are there? Three parts. What are they? No, 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 no. Parts of a long bone, it comes with physis name. Epiphysis, metaphysis, diaphysis. So what are the names of the ends, two ends of epiphysis, and the shaft? Diaphysis, and in between them a small portion will be metaphysis and your epiphyseal end plate, epiphyseal plates. Okay. Now these are the parts of a long bone. Now coming to the blood supply of a long bone, what are the basic blood supply? Hmm? Nutrient artery, then your periosteal arteries, then your endosteal arteries, then will be your metaphyseal arteries, epiphyseal arteries. Okay. So these are the things. Now, do you have any idea that we are telling you about the nutrient foramen from which the nutrient artery is coming, but in any bone we generally don't see the nutrient foramen. Why? It is there. Nutrient foramen is there from which the nutrient artery will be coming out. But why don't we see those nutrient foramen? So because the outer layer of the bone has a covering. What is the name of the covering? Periosteum. And what is endosteum? Cover of the inner line. So basically the inner line is formed by cells. So what the layer that covers the inner line will be your endosteum. Okay. Now this periosteum usually is a thick layer. So what it does, it covers the nutrient foramen is exactly at the diaphysis level. That is at the shaft level in the almost at the lower end part near the epiphysis. Okay. So what happens, the periosteum layer, it generally covers this nutrient foramen in most of the cases. That is one point. Second point is that this nutrient foramen is roughly 1 to 2 millimeter in diameter. That is a very small foramen. So in naked eyes you cannot appreciate that much small foramen. So that is second point. So these are the reason that and also the nutrient artery is a very slender thin artery. So that is why due to these three reasons you cannot appreciate that nutrient foramen even in a live person also. You cannot properly appreciate those nutrient foramen. But in certain cases the foramen becomes a lot bigger. During that time we can sometimes appreciate those foramen. So that is about the basic information about a bone. Now in bone there are certain types of cells. What are they? Certain. So what is the difference between osteoblasts, osteocytes and osteoclasts? Then, okay, they differentiate. So basically, as the name suggests, we have osteoblasts. So as the name suggests, osteo means bones. So this is osteo means bones and blasts means forming. So osteoblasts means bone forming cells. This osteoblasts then gets modified into osteocytes. Osteocytes come from again two words. One is your osteo, that is bones. Cytes means cells, that is your bony cells. Then finally there are certain other types of cells, that is your osteoclasts. These cells are your bone resorption cell. Now let us understand them. So osteoblasts are those cells that are in its immature form or blastic form, which eventually give rise to the bone substance. That is the whitish bone that you see. That bone is formed by this osteocytes, and this osteocytes is formed by this osteoblasts. So osteoblasts are certain cells that help in formation of bones. By how? By converting themselves, these osteoblasts, into osteocytes. These osteocytes are the bony cells. They join together to form the whole bone. Okay, that is the osteocytes. And osteoclasts are bone resorption cells. Bone resorption cells means these cells will help in breaking down of bones. Why this is necessary? Suppose a bone has become injured. Okay, now you need to clear off the necrotic bony parts. So who will do that? The osteoclasts will do that. And as a person grow old, they have a lot of osteoporotic. Okay, just go through them once. No need to break your head right now for these things. This is a stage where the bone becomes porous. Okay, osteoporosis is a stage where the bone becomes porous. Porous means it will be weaker than a normal healthy bone. It generally happens in case of females roughly at the age of 50 to 55, and in case of males around 65 to 70 years of age. Why it happens earlier in case of females? Due to menopause. So estrogen plays a vital role in maintaining the bony texture in a female bone. So what happens after the estrogen levels comes down after menopause? The bones become weak because the protection is gone. Okay, but in case of males, that is not the fact. That is no factor. So it remains stable throughout the life. Okay. So that is the reason for osteoporosis coming earlier in case of females. Now these are the three cells. So this osteoclasts basically helps in killing or removing the necrotic tissues and the other substances that are not helpful for the bone. But what happens if these osteoclastic cells become more than these osteoblastic cells? At that time, the bone keeps on becoming weaker and weaker, and we get broken bones. Okay, so you will see that in certain diseases, the child or the young adults will be having breakable bones. So those breakable bones are the reasons of having high osteoclastic activities. So what we do in case of osteoporosis also, there is a treatment. So we give certain medications to improve the osteoblastic activity and reduce the osteoclastic activity. In osteoporosis, we try to improve the osteoblastic activity and try to reduce the osteoclastic activity. So bone dissolving part we try to reduce, bone formation part we try to improve. Okay, so this part is gone. So parts of long bone is covered, blood supply is covered, and bone is made up of, that bone is a not an inert substance. Okay, bone also has a life. Since it has a life, it will also be having diseases. So we get bony diseases. So what substance will get disease? Any living substance will get disease. So in generally we see that the bone are just whitish substances without any function, but the bone has its own blood supply, own nerve supply, and everything is there in case of a bone. And infection also easily spreads in case of a bone. Okay, even you will see that bones are one of the most important uh, part of our body which get easily infected. Have you heard of Pott's spine? Pott's spine? You haven't heard. So Pott's spine is basically TB of spine. What do you mean by TB? Tuberculosis caused by tuberculosis is a disease caused by Mycobacterium tuberculosis. Okay, so TB spine is a disease which is caused by Mycobacterium tuberculosis. So we usually hear that tuberculosis occurs in case of lungs only, but that is not the case. Tuberculosis is a dangerous disease that it can happen anywhere in our body except the nails. Okay, except the nails and our eyes, anywhere TB can happen. Okay, TB is such a dangerous disease. TB can affect your brain. TB can affect obviously the lungs, the ileum you know na. Okay, it can affect the ileum. So in ileum we generally see TBS like this. Suppose this is the ileum. Okay, this is the ileum, just ileum portion. You will see that in case of TB, this portion becomes like this. Okay, it gets strictured, it gets narrowed. Okay, it happens in TB. So leave TB for now. Just going through them once. That I want to tell you that this bones easily gets infected. Then bones are the places where it easily gets metastasized. You know metastasis? So in case of any cancer cell, those cancerous cell can easily metastatize to the bones. Okay, can easily metastatize to the bones. So for example, in case of prostate cancer, the cancer cells can easily metastatize to the back of, the vertebra. That is our backbone. They can easily metastatize to the backbone. Basically, it is the primary site of a prostate cancer. Okay, in prostate cancer, you will see that the person will be having back pain because of metastasis only. So in this way, we can easily identify that what is the stage of the disease. So in an advanced prostate cancer, the backbone will be affected. Okay. Similarly, in case of our breast cancer. Okay. So that is how fragile, or how not fragile, the term should be that is how infective the bone can get. Okay. So from this we get one type of fracture, that is our pathological fracture. Now what is pathological fracture? So what is pathology? So whatever is abnormal to our physiological body is pathology. Suppose there are certain properties, for example, plasma proteins. So plasma proteins has certain properties in our body. Okay, there are certain metabolism in our body. So this is the physiology of our body. What is normal in our body? Okay, our body try to maintain a homeostasis stage. Okay, but in case of pathology, these things get overturned. Okay, so the disease part is the pathology part, the normal part is the physiological part. So pathological fracture means any fracture that is caused by any pathology, not trauma. Fracture is another type. The fracture that you usually know is traumatic fracture. Traumatic fracture means due to any accident, due to fall, that is traumatic fracture. But pathological fracture is due to metastasis, due to infection, the bone becomes fragile, or due to osteoporosis, the bones become fragile, and these fragile bones usually break down. That is pathological fracture. There is another fracture known as stress fracture. Suppose an army personnel keeps on walking and walking, marching and marching. So from this, the bone, especially the fibula bone, it sometimes breaks down. That is due to stress. Or else you will see that in case of most of the cases females, adult females at their 40-50 of age, you will see that while walking on the ground for a long time, they get Chopart's fracture. Okay. Chopart's fracture. This hashtag is a informal way to represent fracture. You will see that in any prescription, they usually represent fracture by this hash. Okay. So whenever this hash is mentioned, you understand that that is a fracture. So Chopart's fracture. Usually the base of the foot it gets fractured. Okay. And the most important part is that the female, or even if it happens in a male, they cannot know when he or she got the fracture. After 2 to 3 weeks, it gets swelled up, and after that they come to know that something is happening in my foot. And when they take an X-ray, they will see that the calcaneum or the talus gets broken. Okay. And they will say that I don't know, I haven't got into any accident or any injury, but why it happened? So you will take the history. Here we come to know another important thing, that is history. As I have already told you that this class will be more of an informal type of class, and I will just tell you the basic things. History means whenever a patient comes to a doctor, you need to ask the patient that what is their complaint. First of all, after knowing the complaints, that is the chief complaints, like I am having fever from 3 days, I am having cough for 2 days. In this way, you will also write that fever for 3 days, cough for 2 days. Write this like this, you will write, okay, in the prescription. Then comes history of present illness. So you will just elaborate the thing. So let us take this example only. Suppose the patient came with that I am having swelling in my foot for 3 days. Okay. So swelling in the foot for 3 days. Then you will ask history that from did you had any extra work in the last week? So they will tell yes, like 1.5 week earlier I had a function in my home, so I had to work a lot in the field to serve the people and to see the cooking part, or to go to the market to bring something. So I had to see these things. So at that time you will see that you got a very important clue that she had to work a lot, and since female in the house, they usually work a lot. That has been the norm. So fracture is break in the continuity of the long bone. It can be traumatic, pathological, or stress fracture. Now coming to the repair part. Okay, let us discuss certain patterns. Do you know how many types of bones are there in general? So there are mainly 5 or 6 types of bones. One is your long bone, another one is your short bone. Short bones are short, certain bones are long, but they come in the characteristic of long bones, but they are short bones. Okay. For example, your ribs. So these are short bones, or clavicle. Clavicle is a short bone only, but it has the features of a long bone. So there are long bones, short bones, flat bones, asymmetrical bones. So certain bones such as your vertebra, these are asymmetrical bones. Okay. Now comes your sesamoid bones. So what is a sesamoid bone? Very good. So a bone that develops in the tendon of a muscle, that is your sesamoid bones. So in our body there is patella. Patella is a sesamoid bone. Then pisiform bone is a sesamoid bone. Where is patella located? In the kneecap. The kneecap is the patella bone. Okay. Then comes your sesamoid bone, pisiform bone. Pisiform is a part of carpal bone. So this wrist is formed by carpal bones. So here this bone is your pisiform bone. You can easily palpate it. So this is the pisiform bone. Okay. And fun thing is that this bone gets ossified much later. At 12 years of age, this bone will completely ossify. Okay, that is your pisiform bone. Now, so these are sesamoid bones. Then comes your pneumatic bones. What is a pneumatic bones? What is pneumatic? The term means filled with air. Okay, filled with air. Pneumatic means filled with air. So our maxilla is a pneumatic bone. All our sinuses are pneumatic bones. So here our maxilla is present. Maxillary sinus is present. So in front of it is the, in front there is maxilla, and behind we have the maxillary sinus. So this maxilla is a pneumatic bone because it is filled with air. Similarly, our ethmoid bone is a pneumatic bone. Okay, so these are our pneumatic bones. Now, yes, this is roughly the types of bones. Now coming to the fracture. Suppose this is a femur. Okay. Any wicket fell down? Anyone watching cricket? You are the culprit. You are the culprit. Why you told that he is watching cricket? You are not a good friend. Okay. So basically, don't watch cricket right now. Just focus on the class. So this is a femur. Okay. So here you will see that there are certain kind of fractures. One is your transverse fracture. So this is a transverse fracture, directly transected out. This is an oblique fracture. This is an oblique fracture. Okay. Then there is another type of fracture, that is your spiral type of fracture. This is your spiral type of fracture. Then these are the basic types. Now there is another type, that is your open fracture and closed fracture. So basically, what is fracture? Yes, fracture is a break in the continuity of the bone. So there can be open fracture and closed fracture. So what is an open fracture? So open fracture means the fracture has protruded out of the skin. So in outside we have skin here. Suppose this is the thigh. Suppose this part has come out. Okay, some part of the fracture has come out of the skin by breaking the skin. That is an open fracture. But if this part does not come out of the skin and remains inside the skin, that is a closed fracture. Okay. So open fracture, closed fracture. Then there is comminuted fracture, complex fracture. These things are there. Okay, complex fracture means 3 pieces together, comminuted. These types are already there. Now coming to the healing part. So our body has certain mechanism of healing a fracture. Fracture healing. So let us know the steps of fracture healing. The first step is that your stage of hematoma. Stage of hematoma formation. Okay. Suppose this is the bone. Don't talk. So this is the bone and there is a fracture like this. Okay. Or like this. There is a fracture. So after the fracture happens, the body tries to heal it. Okay. So the body has certain mechanism of healing any injury that happens in our body. So during healing time, what body will do? First of all, there will be hematoma formation. So there will be hematoma formation. So what do you mean by hematoma formation? No, blood clot is not hematoma. So hematoma, the result that we see, that is a clotting, but that is not blood clot. Blood clot has a separate mechanism. First of all, there will be bleeding, inside bleeding. Hematoma, okay, hema means blood and oma means within the, there is a tumor formation due to bleeding. Not tumor, swelling due to those bleed. Okay, that is your hematoma. So, like surrounding the cortex part, there will be your bleeding. So that is the stage of hematoma. That will happen. So the hematoma has to form in certain days. It will form completely within 3 to 4 days. Or let's say less than 7 days. That is the first stage of a fracture. Then comes your stage of after hematoma, stage of granulation tissue. So it will roughly take 1 to 2 weeks. Now what is granulation tissue? These things you will study in pathology mainly. So granulation tissue are certain substances which will help in proliferating and give rise to certain cells. Okay. Now this fracture bone will have certain granulation tissues which are formed by your vessels and certain other macrophages, mast cells. They will come here, neutrophils, and help in proliferation of those osteoblasts and osteocytes. They will help in bone formation. That will roughly take 1 to 2 weeks. So they will help in making new vessels. So new vessels will start developing here in the fracture part, and new bone formation will also start developing, but that will be an immature form, and the bone obviously will be mobile. So this is a mobile stage. Mobile means if you move it, it will break. It has already broken, but if you move it, it can twist. The second stage is also a mobile stage. Then comes the third stage, that is your stage of your callus formation. That will also roughly take 3 to 4 weeks. Now, callus formation, callus is a stage where new bone try to completely develop. Okay, so these osteoblasts and osteocytes, they develop in the stage of granulation tissue formation. So after that, when these bony particles together, they form a fibrous structure and keep on like filling up the gaps in between them, and the vessel starts to form in between them. So together they then form an immature bony substance, that is the callus. Okay, this callus stage will look somewhat like this. You will see that there is bony formation, but it will be an immature bone, and obviously it will also be mobile. the callus bone usually is non-mobile. Here you will see that the bone starts to mature. Okay, like this. Then comes your stage of remodeling, and final stage is stage of modeling. So what is stage of remodeling? What is left after callus formation? So after callus formation, the bone has to mature. Okay, so it tries to retain the structure. Okay, of a broken bone. I mean of a normal bone. It tries to retain the structure, though it cannot completely retain it, but it tries to retain the structure and the strength of the bone. This roughly takes 1 to 2 years. So for roughly 2 years, the bone is still in a broken position. If you take out an X-ray, you will see whitish line at those places. If you take out an X-ray of a bone that has been broken, after healing also you will see whitish line. So through this whitish line you can predict that like within the last 1 or 2 years this person got a trauma. So there comes your forensic part. I am just bypassing one of the thing. There comes your forensic part. Suppose an old man comes to the trauma with severe hand movement difficulty and hand pain. Okay, and after examining you will see certain bruise marks here in the hand, in the arm part. Okay, then when you will see those bruise mark and you try to rotate the hand, he will do like this. He will not allow you to move the hand. After that you take out an X-ray, you saw that there is one big fracture in the humerus and small white lines in the olecranon process, in the radius, in the ulna, in the wrist bone. These things you can easily find. And after going through the process, you can easily derive that he has been bitten by someone and he has been continuously bitten by someone. So here comes the forensic part and the legal part of the medicine. And this is very much common. Okay, in case of children also, we give one term, 6 penny bruises. So some children who are not bitten, there is a different term for this, that is tortured. Some children are tortured heavily by, suppose not parents, by some others, and even by parents. So they develop certain metaphyseal fractures. So they appears like 6 penny bruises. 6 penny means these are coins. So it appears such as the coins have developed in the hand. Okay, so these bruises develop. Why? Because these are metaphyseal fracture. So diaphysis, epiphysis, in between there is metaphysis. So due to continuously beating the children, they develop metaphyseal fractures, and year on year, it gives rise to this 6 penny bruises. You can easily Google these terms and you will see pictures of those children. Okay, and that is also very much common. Now again coming to the remodeling stage. So during this remodeling stage, if you carry out an X-ray, you can easily find callus, which you will see that in a long bone. Suppose again this is the femur, you will see one white line in between where the fracture had already occurred. This is a completely normal bone, just the person has to take proper care that not to put extra stress on this femur. And that stage of remodeling, it takes many years. Stage of modeling, many years. Why? What is the stage of modeling? Here you cannot differentiate a fractured bone from a normal bone. That is this stage of modeling. It takes 5 to 10 years to go to that stage. Okay, or more than that also. At that stage, if you take out an X-ray, you cannot differentiate a broken bone from a normal bone. So these are the 5 stages of a fracture healing. Now this healing can be done by 2 processes. One is your primary. You know now 1 upon that 0 is primary. So that is primary healing and secondary healing. What is primary healing? Primary healing is that now a person comes to you after a traumatic accident, and after that person come to the trauma, you carried out an X-ray and you saw that he has got a radius fracture. Radius fracture. Now this radius fracture, after this, what will you do? There are certain other treatment process, but if we need to operate that person, we will operate it. And during operation, what will we do? We will not allow these stages to happen. Okay, we will just bypass them. What we will do? We will clear this hematoma. There is hematoma, we will clear it. Like this. Suppose primary healing is happening, so we will just clear it out. Just a second. You will see that the hematoma has been cleared. So what the orthopedician does, he clears the hematoma, but these parts are still broken, but the hematoma is cleared. So what is the next step? He attaches both the parts. Like this, he or she attaches both the parts and they put some pins like this or like this. They put certain pins to stabilize the bone. So you will see that after operation of a fractured bone, they usually comes in stretcher or wheelchair with pins and screws attached to the fractured bone part. Okay, so they oppose both the bones, and after 3-4 weeks they do a second surgery. A second surgery is done to remove those things, and the bones get completed. So it is a faster process. Okay, faster process of bony healing. That is your primary healing. So what is happening in this primary healing? In this primary healing, we are not allowing the hematoma to persist. So we are also not allowing the callus to remain. Okay, we are not allowing the callus to form. So in case of a surgery, after surgery, you will not see this stage. So these white lines will not be visible. Okay. So callus formation is not seen in primary fracture healing where the person is operated. Now comes the secondary fracture healing. In secondary fracture healing, there is no operation. Okay. So does that mean that we will not operate the person and just leave it as it is? No. We will try to manipulate. Okay. How it is manipulated? It is reduced. The fracture end is reduced by pulling and pushing. Okay, like this. So if you have gone to any trauma center or any orthopedics clinic, you will see that after the person comes with a fracture, as it is seen in an X-ray, you will see that the orthopedician try to manipulate those hand. Suppose, let me give one example. Please come. Is it okay if I touch?
Yeah.
Oh. See, suppose there is a fracture here. Okay. There is a fracture here. Now you want to reduce it. How to reduce the fracture part? So one person, he will be sitting or standing in a, lying down or sitting. So one person will hold this hand like this in this direction, and another person like this direction, and both of them will pull like this. Okay. They will pull like this, and that is a very vigorous act. Like it is proper pulling, not like this that I am doing like this and pulling like this, not like this. One person will pull from that side, another person will pull from this side. Sit down. So then what will happen? Suppose the fracture is, this is the radius. Suppose this is the radius. Okay. Now it has fractured like this. It has fractured like this. One part has gone proximally, another part has come distally. Now, while pulling both the ends, these both ends try to come like this and attach like this. So that is the main purpose of reducing the or extending the part and positioning the fracture ends. So after that, a second X-ray is taken out. We will see that whether the reduction has been done properly or not. The reduction has to be done properly. And if in X-ray we see that the reduction has not done properly, so we try to do a second attempt after some days. Okay. So, and then it is plastered. After that, plastering is done. so that these both structure remain together and there is a faster healing process. That is the main purpose of secondary fracture healing. So that is secondary fracture healing. So here you will see all the stages. All the stages are seen, but it will be a more faster type of healing, but not faster than primary healing. So secondary, obviously it also depends. If the fracture is a small fracture, then secondary healing will be faster. Okay. Now in primary healing, we do operation and try to reduce the structure intraoperatively, and in secondary healing, we try to do it manually without cutting the skin. Now, is operation also can be a part in secondary healing? It can be a part. How? So, sometimes in secondary healing, we do the operation part. Suppose the skin has been broken. So, we try to suture the skin or open the part, but we don't clear the hematoma part that we were doing in the primary healing. We were just removing the hematoma part and opposing both the structure. But in case of secondary healing, if we need to do the operation also, what we do, we leave the hematoma as it is or try to give it a proper shape, but we try to repair the surrounding structure. That can happen in secondary parts. I have told you this thing because, or else you will see that the person has undergone secondary healing, but I mean, the person is not with any pins and screws, but after fracture he has undergone an operation. So to avoid that confusion, I mentioned this part that in secondary healing also, operation can be done. In that part, we just clear the debris part. Suppose the bone has broken into multiple fragments and got impacted in the skin. So we are cleaning the skin part. We are not doing anything with the fracture part. Okay, that is also comes in operative part. So this is the two part of fracture healing. Anything left? Okay. So now there are certain stages, further stages. One is your, suppose a person came with fracture. So you need to give certain emergency treatment. Emergency treatment you need to give. In emergency treatment, you will follow R.I.C.E structure. R.I.C.E means first of all rest. You need to provide rest to the fracture part by using one splint. So you will see in elbow fracture we do like this with a splint hanged around our head like this. So to give a support so that the hand is not hanged like this, so it gets a support. So that is rest. Then we give ice therapy. Ice therapy means we use ice to reduce the swelling. Then in C, we try to compress the fracture by doing like this, doing like that. We try to compress the fracture. Okay. And in finally E stage, we evaluate the fracture and check for any further changes that we need to make. That is your emergency treatment. That is after the person comes after getting fractured. And after that comes the treatment part that I have already mentioned. That is your operation part. If it is an open fracture means it is pierced out through the skin. We can do nothing. We have to take the person to the OT, that is operation theatre, and we have to operate it. But if the person has not got any fracture of such kind, just a small crack has happened, we try to manually or closely manipulate it and do a fracture bandage. Okay, that is a closed process. An open process means we have cut the structures. So that is your second stage. Then finally comes the stage of rehabilitation. In rehabilitation, we need to tell the patient how to we try to rehabilitate the person with the fracture healing process. That is, you should not move the hand, you should keep it like this, you cannot do this, you cannot do that. That is the stage of rehabilitation until the person can have the fracture completely healed. So for 1 month or 2 months, we prescribe them or advise them to do certain things so that the fracture easily heals. Okay. First is rest by using splint, then with ice therapy, then compression, and E is, I just forget, it is evaluation mostly. Let me see once. Yes, elevation. Okay, elevation. So that is elevation. Elevation means, So that is not the case with hand. Suppose a person got a fracture of the femur, okay, so that has to be elevated like this, so that it is in a straight line, okay, so that the fracture heals, or else the person will move the leg here and there, and due to this part the fracture cannot heal properly, so it is elevated. You will see in any orthopedics clinic, orthopedics OPD, not OPD ward, okay, you will see that the foot is elevated with the help of a Thomas splint and a pulley and screw like this, and with a bag. Usually certain weights have to be kept in a bag, but we usually, what we do, we put certain bricks in a bag, and after that the pulley goes like this and the foot is hang like this, okay. Basically you have to put certain weights to the foot, okay, and there is a measurement also for that. Now coming to your question, so prosthesis is a different thing. Suppose the bone has got amputated, or the bone has completely, like what happens in case of, okay, in case of femur, what happens, there is a neck part. Now just proximal to the neck there is no blood supply, that is an avascular area. How it gets the blood supply? From the distal part, like this the femur gets the blood supply. So if a old person gets fracture in the neck of the femur, what happens, blood cannot reach there, so by the time the fracture heals, that part gets necrosed, okay. Necrosis, you know na, that parts get damaged or dies off, okay. So during that time we need to put certain prosthesis. Prosthesis is nothing, that is a metallic foreign substance. So we use a titanium, or there are certain times also, certain names also, such as Austin Moore, Flint. We use those prosthesis. It is a fake femur that we usually make with metal and put it there in the place of the original femur. That is a prosthesis, okay. So that comes the prosthesis. That was your question, na? Yes. So sit down. Suppose we have reached a stage where the bone has undergone certain gangrene, okay, or we had to amputate the bone. So during that phase we need to cut down the bone. Suppose keeping the bone is more riskier for the body, because if we keep the bone, a unhealthy bone for a longer time, the person may undergo sepsis, because infection is also spreading, right? So the person may undergo sepsis. So to prevent the sepsis part, we cut the bone and place on prosthesis. Sometimes we also need to do amputation. Suppose the bone and the skin is completely crushed and the vessels are gone. If vessels are gone, then you can do nothing. You cannot revascularize, or if you need to revascularize again, you need to do it very quick. So suppose if your setup does not have any revascularization center, by the time you send to a vascularization center, the foot has already undergone gangrene, and once gangrene starts, you can do nothing. That is a gone case. So during that time we amputate, we completely remove, okay, or else the gangrene will keep on moving proximally and the person will eventually die. So that is the part. That's all, okay. Now coming to, so the emergency care I have told, open and close reduction I have mentioned, rehabilitation I have mentioned. So these are the main thing of fracture treatment. Now coming to complications. This is the last part, complications. Now in complications part, I will not give you the entire list, just give me 2-3 basic points. One is your shock. What is shock? So what is shock? Anyone? Shock means falling of BP. What is BP? Blood pressure. Very good. So BP is blood pressure. So falling of blood pressure is shock in simple terms. That is a more elaborate term, because in shock you have hypovolemic shock, cardiogenic shock, septic shock, distributive shock, neuronal shock. These are there. Okay. In case of fracture, we usually see that the person comes with hypovolemic shock. Hypovolemic, I think you know. You know hyposmolar, hyperosmolar. So hypovolemic means, hypo means what? Hypo means loss or less. Volume means what? Body volume, that is blood volume. So the person how this BP is maintained. This BP is maintained by blood circulation. Okay. Now, if a person loses a lot of blood, so the BP will automatically fall. And since the BP, after the BP falls, that person will enter into a shock stage where the BP will, what is the normal BP? 120 by 80 for simple terms. There is a range also. Basically, there are certain stages of BP shifts. So that person, you will see that the BP becomes 60 by 40 or 80 by 40. 80 by 40 is also very good. 60 by 40 or 60 by 30, that is a very dangerous situation. Okay. So that happens in a shock case. So before dying from fracture, the person will die from shock. Okay. So that is one complication of having fracture. Then next, these are your immediate complications that you will see that in accident spot, a person has undergo fracture, but before fracture he or she had a head injury, and due to this the blood has a massive loss of blood happened. So the person went into shock, and after shock the person died. That is one complication. That is your immediate complication. Now in early complications, I don't want to mention these terms because it will be not helpful for you. That is your ARDS and fat embolism. These are your early complication. And late complication means your non-union, malunion, or delayed union. So, what do you mean by complication? বল তুই বস বলছি এটাই তো কোশ্চেনটা না ঠিক আছে বস এটা কিভাবে বোঝানো যায় ধর এক্স্যাক্টলি তো এটা একটু মানে মজা করে বললে ধর সি what was his question is that if the blood comes out through the vessel, the blood is within the body, the blood has not come out of the body, but will that person will go into shock because the blood has not come out of the body, but the blood has come out of the vessels. So that is your intravascular, not intravascular, that is also your extravascular, but not your out of the body. So what happens in this, suppose you are in a home. So in your home there are certain pipelines. Now your pipelines got damaged, okay, and water is coming out and filling up your whole home. So now you're in your home, the water you cannot use it. It has already come out of the pipeline, so you cannot use it. Okay, it will be in the floor, but the total volume of the room will be same. Got it? In that case also the damage has already been done. Got it? Because the water should flow in the pipeline, na? In that way only you can use it. Similarly, the blood should flow in the vessels. Only that blood you can use. If the blood is spread throughout the body, then you will develop hematoma, swellings in the body due to this blood, and that is very much dangerous. In most of the cases, after accident, you will see that after 1 to 2 days, the person dies. You will tell that nothing happened to the person, he is or she is completely all right. But after two days, suddenly the person collapsed. Why? Because there was one internal bleeding. That is your internal bleeding, not intravascular, internal bleeding. So internal bleeding was happening, and that person went into shock, and that bleeding was hidden, so you just missed it. That happens in case of splenic hemorrhages sometimes. So suppose a person after undergoing accident, the person comes. Spleen is an organ in our body, so that gets hemorrhage sometimes. Liver hemorrhage happens. What happens? The person usually comes after an accident, and after the person comes from an accident, what happens? You will see that everything is fine, no fracture, nothing happened, but hemorrhage has occurred. So how can you see those hemorrhages? You need to undergo CT scan or MRI. These things you have to do properly within the time, or else after 5-6 hours you will see that there is no fracture, but hemorrhage has already happened. And due to internal bleeding, BP has fall and the person went into shock. And after the person went into shock, suppose the BP dropped to 40 by 24. At that stage, you can almost do nothing. You can give some NORADs, that is your noradrenaline, adrenaline, dopamine, these things you can give, but from 40 to 24 to bring it to 80 to 80 by 40 is a very like tough job, because with this shock other metabolism are also getting hampered. The tissues, since blood is not present properly, blood cannot be used, the tissues are undergoing damaged, and after the tissues undergoing damage, tissue necrosis starts to develop, and after that blood is not being supplied to the brain, and brain is a very delicate organ. If blood does not come there, then brain hemorrhage cannot, not brain hemorrhage, brain can also undergo necrosis due to inavailability of blood, because with blood oxygen also goes na, so the brain will not get enough oxygen. So ultimately that is a gone case, because by the time you improves the BP, other things has already damaged. So that is a there is a term for this, your multi-organ damage. That is your multi-organ damage. Okay. Now coming to these terms, these are the last things that I want to discuss. Suppose complications means any problem that happens with an issue. Suppose after fracture there are certain problems that can happen outside the fracture. So first of all, your immediate complications that I have already told, that the person can go into shock. Then comes your early complications, and then late complications. Let us discuss the late first. So in late complications there can be non-union. Non-union means you did all the things but the bone has not united. Okay, the bone is still broken, and we can declare a bone as non-union bone if the bone does not heal more than 6 months. If after 6 months also the bone has not healed, so we call it a non-union bone. Then comes your malunion. Suppose a bone should fix like this, but it got fixed like this. You will see in certain reels also they are rotating their foot like this. So they are presenting it in a funny way, but that is not a funny thing. Suppose the femur or the tibia got fractured, but it got healed, but in a irregular fashion. So it should be like this, but it got another joint in between and it got like this. So it becomes a movable part. That is a malunion. Union has occurred, but not in a proper way. That is your malunion. And delayed union is any union that happened after 6 months, okay, or after 3 months. That is your delayed union. So it is taking time. Now coming to some points about ARDS and fat embolism. So emboli, I'm just telling you the thing. Emboli is a blood clot. Suppose a thrombus has formed. Okay, so that is the last thing. Suppose there is a blood vessel. This is a blood vessel. Through it RBCs are flowing. And after there is an injury, this RBC and platelets and everything, this RBC will come here and accumulate, or these platelets will try to heal this part. And during this process, there sometimes happens clotting, blood clot formation. Blood gets clot. And after clotting occurs, this clot, they keep on accumulating and form a big thrombus. Thrombus is a big blood clot. Now, the thrombus will not cause that much problem when it is present here. It will only obstruct the blood flow. That will obstruct the blood flow, that is for sure. So blood cannot flow properly. Suppose that is a heart that is present in the heart, and this thrombus is present here. So blood cannot flow to the heart, and that will give rise to your myocardial infarction or stroke. Okay. So now this thrombus also happens in this hematoma part, since there are clotting happening. So in this part also there will be some thrombus formation. Now this thrombus is a static substance. If it moves, if it goes away from its place, we call it emboli. Then it becomes emboli. And in case of fracture, we usually see fat embolism. So suppose in a long bone fracture has happened, thrombus developed. Now this thrombus went into the heart. Okay, so the person will die from stroke. that is your fat embolism. Okay, got it? If not got, then also it will be fine. Then comes your ARDS, that is your acute respiratory distress syndrome. Here, that is an acute stage, the respiration will be hampered here. Just know this term, let us not go into the detail. Here, the respiration will be hampered due to shock and various other factors. Okay, some microorganisms, some granulation, not granulation, some fibrous structure will keep on accumulating in the lungs. Let us not go into the detail of ARDS, acute respiratory distress syndrome. So there will be breathing difficulty in the patient. So the patient came with fracture, no shock, nothing, but there is breathing difficulty. So that can indicate both fat embolism as well as your ARDS. So you need to treat them, and these are very much like deadly things to happen in a fracture. So that's all in not short, like it has gone into a big class regarding your fracture.